As a kid, I loved stingrays, and in fact, I still do. When I would go to the aquarium, I would wonder, what is it that makes their stings so poisonous? Stingrays can actually be classified as a venomous fish. Today, I want to tell you about the poison organ of the stingray. First, I will discuss the tail components. Second, the firing of the poison. And third, the effects. The stingray's tail can actually be much more complicated than it appears to be. Eagle rays and stingrays have barbed or serrated spines. However, the trigon's barbed spine is much longer and narrower than the Mylios. Their dart is actually almost 1/4 the length of their own back. The length of a dart varies from 8 to 7 to 12 to 6 centimeters. Their dart is replenished every year that the stingray is alive, and occasionally this process will happen too quickly, and if the old one does not fall off before the new one forms, sometimes the stingray can have 2 to 4 stings at once. Their dart is used as an arm of defense. It is entwined by the tail by many strong ligaments and muscles, creating a lateral movement. If we isolate a sting and observe it, we can see that there are 2 grooves on each side of a ridge that become shallow in width and depth at the base. Now that I have told you about the tail components, I am now going to move into the firing of the poison. Stingrays will not fire this poison unless they feel scared or threatened. Some observers are convinced that there are something other than the laceration by its serrated spines necessary to cause the pain and inflammation that is produced by it. It wasn't known until now that a poison apparatus actually exists in the tryons and the Mylios. The emission of the poison itself takes place in a very simple manner. The poison organs are situated into 2 grooves which penetrate to the deepest part of the groove and there continue laterally and above into 2 small tubes which are ways for the passage of the blood capillaries, which supply the connective tissue surrounding the gland. The sting will introduce itself into the wound and the sheath that is drawn back towards it then presses on the gland, which then fires a poisonous liquid that flows towards the narrow groove, inoculating the wound. I just went over the firing of the poison, and now I am going to move into the effects. Most stingray wounds are not fatal, but there are some cases that are. Along with a stingray wound comes many symptoms. Symptoms such as nausea, vomiting, fever, chills, muscle cramps, swollen lymph nodes, and you also may notice that the wound turns blue or red, which is normal for most wounds or injuries. The pain can last up to 48 hours. However, the pain is at its worst during the 30 to 60 minutes prior or after the initial puncture. This wound can also be highly capable of turning into a bacterial infection. This is where we get into the more fatal cases. These include cellulitis, osteomyelitis, necrotizing fasciitis, and septicemia. Today, I wanted to tell you about the poison organ of a stingray. I first discussed the tail components, then the firing of the poison, and then the effects. My question as a kid, what is it that makes their stings so poisonous, has now been answered by reading these articles.